Assalamu alaikum, this is Dr. Hasna and today we will be talking about the atypical ribs. As you all remember, we have already discussed the typical rib. If you haven't watched that video, then go ahead and do go through it. So today, let's discuss the atypical ribs, which are basically the first, second, the 10th, 11th, and the 12th ribs. First, let's start the discussion of the first rib, which is the most important of them all. The first rib is identified by the fact that it is the shortest, broadest, most curved rib. And the most important identification point is that it does not have surfaces that are convex, rather its surfaces are upper and lower, in contrast to the typical ribs which had an outer surface and an inner surface. It is basically flattened from above downwards. The side determination of this rib is mostly done when you keep it on a surface. Both the ends should be touching the table. That means this is the upper surface. However, if you keep it the other way, you will realize that this is lifted off from the table. Hence, this is not the right upper part. This is the lower surface. Other points of side determination include that the anterior end is larger and the posterior end is smaller. The outer border is convex, inner border is concave. And the upper surface of the shaft will be crossed by two grooves with a ridge in between them. Now let's talk about the bony features of this bone. Posteriorly, it consists, like every other rib, a head, which consists of facets to articulate with the first thoracic vertebra, the neck. Now, what's important of the neck in the first rib is that the neck anteriorly is related to the following structures from medial to lateral side. The mnemonic is chain, van. So chain, V-A-N. So the chain is the sympathetic chain, the thoracic sympathetic chain. Going even more laterally is the V structure, which is the posterior intercostal vein. And more laterally is the A, which is the superior intercostal artery, and N is the nerve, which is the first thoracic nerve, ventral ramus of the first thoracic nerve. So that was the neck. Then comes the tubercle. The tubercle is the area where the angle starts. So if you remember, in a typical rib, the angle started 5 centimeter lateral to the tubercle. Here in this case, the tubercle is where the angle is going to start, which is the rib is bent here. And then we have the shaft, and the most important part of the shaft is that it has an outer border which is convex, inner border which is concave. It has an upper surface which is grooved and ridged, but the lower surface is completely smooth. The upper surface consists of the two grooves. What is the significance of the grooves? Is that the anterior groove is consisting of the subclavian vein. So it is a groove for the subclavian vein. And the posterior groove is basically accommodating the subclavian artery and the lower trunk of the brachial plexus. There is a ridge in between these two grooves, and going towards the inner border of this ridge, it becomes a tubercle known as the scalene tubercle, as it gives the attachment to the scalenus anterior muscle. In the anterior end, more anteriorly lies the origin of subclavius muscle, and posteriorly lies the costoclavicular ligament, because if you remember, the first rib forms the sternoclavicular joint. Moving on, posterior to the second groove is the attachment of the scalenus medius muscle. The outer border of the first rib gives attachment to the external intercostal muscle and the serratus anterior muscle. The inner border of the first rib gives attachment to the Simpson's fascia, or the suprapleural membrane. So these were the basic important features of the first rib, which are extremely important. Now let's move on to the second rib, which is another atypical rib. The difference between the second rib and the first is that the second is twice the size of the first rib. The posterior end again bears the head, neck, and the tubercle, which will be very prominent, while the anterior end is large. Here the outer surface is mostly convex. In this case, it is not flattened like the first rib. This is a very unique rib. This also has an outer surface which is convex, but the convex outer surface is facing more upwards than outwards, in contrast to the typical rib, and the inner surface is facing more downwards than inwards. And the most important point of identification in the second rib is right in the middle of the rib lies a tubercle. This rough tubercle gives attachment to the serratus anterior muscle. And this is the most important point of identification of the second rib. And then comes the 12th rib. The 10th, 11th and 12th ribs will only bear a single facet in their head. Apart from this, as you all know, this is the 12th rib, and as you all know, it is a floating rib. Let's go over the few attachments of the 12th rib. In the inner surface of the 12th rib is the attachment given to the quadratus lumborum and the fascia of the quadratus lumborum. Apart from this, the anterior end consists of the diaphragm origin. The upper border gives insertion to the internal intercostal muscle, and finally, in the inner surface is related to, in its medial 3/4, it is related to the costodiaphragmatic recess. So that were a few features of the atypical rib. Out of these ribs, the most important is the first rib. Finally, let's talk about a clinical of all the ribs, and this is the most commonest site of injury in a rib is the angle. This is the weakest part, and this is where most of the fractures occur. Another important clinical is due to vitamin D deficiency in a disease called rickets, there is rachitic rosary. This rachitic rosary causes prominence of your costochondral junctions, and these are visible when you inspect the thorax of any person. So that was all about the ribs. Thank you so much for watching.